Today's topic will be a little change of pace per subscriber request. We will be talking about a technique commonly used in clinical microbiology laboratory, which is gram stain. Gram stain helps differentiate different types of bacteria and determine treatment options. I also include timestamps in the description box down below for an easy quick review. Without further ado, let us click that like button, share, subscribe, ring the notification bell, and dive into the microbe world. Let me give you a quick overview of gram stain. Gram stain works by playing with bacterial cell walls properties. The differences in cell wall properties of gram-positive and gram-negative bacteria lead to different color post-staining. Gram stain differentiate bacteria into two main groups, gram-positive and gram-negative bacteria. Gram-positive bacteria stain with crystal violet dye and give purple to violet color when viewed under microscope, whereas gram-negative bacteria stain pink, red in color with saffron dye. This is due to gram-positive bacteria has thicker peptidoglycan layer when compared to gram-negative bacteria. The purpose of gram stain in clinical setting is to identify types of bacteria that cause infections and help determine course of treatment. First, let me talk about the components that make up the cell wall. Then we go over their properties before gram stain procedures. Most bacteria will have these components as a part of the cell wall. However, some bacteria will have more or less of these components. I will tell you about the function of each component, then we will compare and contrast the cell wall structure of gram-positive and gram-negative bacteria. Plasma membrane. Plasma membrane directs what enters and exits the cell. It has the ability to permit certain substance to enter and leave. This is referred to as selective permeability. Plasma membranes are made up of phospholipid bilayer with proteins scattered in the layer. The phospholipid has the head and the tail. The head is hydrophilic, love waters, and the tail is hydrophobic, hates water. Second, cell wall. Cell wall is made up of peptidoglycans, which gives the cell support and structure. This layer is the key of today's topic. Third, capsule. Capsule is the sticky outer layer. It is for protections and attachment. It helps the cell attach to surfaces. Gram-positive. The main unique characteristics are the thick peptidoglycan layer and one plasma membrane. If we are looking at a cross-section of bacteria, the outermost layer would be in the order of capsule, peptidoglycans, and plasma membrane. Some common examples of gram-positive bacteria are Staphylococcus aureus or S. aureus. S. aureus is a skin normal flora but can cause disease if it's in the wrong place. Bacillus anthracis or B. anthracis cause anthrax. Clostridium tetani or C. tetani cause tetanus. Gram-negative. Gram-negative has similar components to gram-positive cell walls, but the gram-negative has a thinner layer of peptidoglycans, two layers of plasma membrane, and polysaccharide. Let's look at it in a little bit more detail. Gram-negative has a much thinner layer of peptidoglycan. The layer is also anchored to the outer membrane. The outer membrane has pores, which are pores that allow substance to enter into the periplasmic space. Periplasmic space is the area between peptidoglycan layer and plasma membrane, the second layer of plasma membrane, of course. The unique feature that is only found in gram-negative bacteria is the lipopolysaccharide, or also known as endotoxin. The lipopolysaccharide is located on the outer membrane. Gram-negative also has an inner plasma membrane layer, which the gram-positive bacteria doesn't have. This second layer that makes gram-negative bacteria naturally more resistant to antibiotic than gram-positive bacteria. Some common examples of gram-negative bacteria are: first, E. coli. E. coli can cause food poisoning. Second, Helicobacter pylori, or H. pylori. When this infects your stomach, it can cause stomach ulcer. Third, Yersinia pestis, or Y. pestis, can infect humans through rat fleas and cause plague. Here is a table to compare the cell wall properties of gram-positive and gram-negative bacteria. Just take a moment to take a look, notice the differences and the similarity between the two. The property of the cell walls for gram-positive and gram-negative bacteria is what play a role in gram stain. Next, we are going over the gram stain procedures. Gram stain procedures. I will just gonna list the step down for the gram stain quickly, and then we'll go over each step in detail. We're gonna have to first make the bacteria slide, let it dry, heat fix it, do the primary stain with crystal violet dye, rinse with water, use the iodide dye, rinse with water, decolorize with alcohol, rinse with water, use the counter stain with saffron dye, rinse with water, and then we'll let it air dry. And that's all for gram stain. That is easy, right? Now let's take a look at why we are doing each step the way we are doing it right now. Let's go. Okay, now we are going deep. First, label your microscope slide with the organism name, or something so you can later identify your slide and where the culture come from. For me, I always label it with at least 2 types of patient identifier if the sample is from a patient, or my culture number with date, time, and my initial. A little bonus tip. If you are new or not familiar with microscope, you can use a Sharpie to make a circle on the opposite side of your microscope slide, where you will be placing your bacteria. This will help you locate your bacteria when you finish staining. Try it and thanks me later. The way to make a smear is to sterilize the wire loop by putting the loop into the flame and hold it there until the loop turns red. Use the wire loop to pick up a drop of water and place it on the labeled microscope slide. Do not pick up too much water because you will have to wait for a long time for the slide to dry before you can go to the next step. Third, sterilize your loop again, and this time you will use it to pick up your bacteria. Select a well-isolated colonies of bacteria and smear it on your microscope slide. It is important to have a pure colony so it is easily to identify what type of bacteria that cause infection. If you do not have an isolated colony, subculture until you have an isolated colony, unless you want both types of bacteria in the same smear for comparison, which could be useful sometimes. Another bonus tip is do not use the burning red loop to pick up your bacteria, because that will kill and burn them off. Instead, after you sterilize your loop, you can cool down the loop by placing it in the immediate agar where no bacteria was growing, and then use that loop to pick up a few of your isolated colony of your choice. Another thing to keep in mind is do not pick up too many bacteria. The key is less is more. A good smear is usually when you almost cannot see anything on the slide once it air dry. Step 4. Let it dry. Don't make the amateur mistake. If you do not let it dry before proceeding to the next step, you will end up washing away the majority of it, if not all of the bacteria by the end of the procedures. Step 5. Heat fixing. When your slide is dry, take it and pass it through the flame a few times. This using heat to fix bacteria onto the slide. This is why this step is called heat fixing. An alternative way is to use methyl alcohol so that the bacteria does not get washed away when other chemicals are used in the next steps. Step 6. Primary stain. Primary stain is crystal violet dye. Flood the slide and leave it on for about 1 minute, more or less depending on the facility policy. Just follow your hospital rules, but 1 minute is a good rule of thumb. I see some places go as little as 15 seconds. Crystal violet dye is a purple dye and it will stain all bacteria. Again, it stains all bacteria. the dye associates itself with the peptidoglycan layer of the bacteria cell wall. Step 7. Rinse with water. Step 8. The iodide dye has brown and gold color. Flood the slide and leave it on for about 1 minute. The iodide dye binds to crystal violet dye molecules to form crystal, which make it bigger and would be harder to wash off. Iodide is a mordant that helps the color stay in the cell walls. If you skip iodide, you can get a false negative. For gram-positive crystal violet plus iodide, you will get crystal in peptidoglycan layer and it won't wash away. In gram-negative, the iodide stays on the outer lipid bilayer, so it washes off in decolorizing step. Step 9. You guessed it, rinse with water. Step 10 and step 11 is kind of combined into one. So it's a decolorizing step. Alcohol. Laboratory typically use alcohol because it is cheap and easy to find. Do not flood the slide and let it sit there on the slide like other stain. But drop the alcohol onto the slide and let it drift off. Anchor the slide at 45 degrees and drop the alcohol onto the slide until you don't see any color coming off, and immediately rinse with water. If you do not rinse with plenty of water right away to stop the reaction, you may decolorize the gram-positive bacteria. This is a very important and sensitive step. I found that 7 drops do the trick, but it depends on how thick your smear is. If this is your first time doing a gram stain, 7 drop may be a good place to start. Take a look at your slide once you are done, then adjust accordingly. The decolorizer remove crystal violet and iodide that are not strongly bound in peptidoglycan layer. This is an important step because you can over-decolorize and that will turn your gram-positive bacteria into gram-negative bacteria. So be really careful. However, if you do not decolorize enough, your gram-negative may be stained purple and could be misinterpreted as gram-positive. Ideally, by the end of this step, you will have gram-positive bacteria remain purple and your gram-negative bacteria colorless. Step 13. Counter stain. Counter stain using saffron dye, which is red to pink color. Flood the slide and leave it on for about 30 seconds. This is to help further distinguish between the two types of bacteria. Since the gram-negative bacteria was colorless, it will take the saffron dye and stain red to pink color. The saffron dye passes through the peptidoglycan layer and bind to phospholipid membrane. Gram-positive bacteria also stain but get overwhelmed by the crystal violet color. Therefore, we still see purple color for gram-positive bacteria. Gram-negative bacteria shows red-pink from saffron dye since it lost the crystal violet dye during decolorizing step. Step 14. Dry the bottom, blood dye the top, and leave it at 45-degree angle to air dry. The key is to let the slide dry before you put it under the microscope. Be careful not to wipe on the wrong side. If you wipe on the wrong side that you have your bacteria on, then you may have to repeat the gram stain again. Benefit: fast, simple, inexpensive, helps with the course of treatments to see which antibiotic should be used for the types of infections. Application: now you know the different types of bacteria that cause infections. It is either gram-positive or gram-negative bacteria. After determining this, you can then perform a sensitivity test to see which antibiotic works for which type of infection. In general, you will not give vancomycin for patients whose infection is caused by gram-negative bacteria, and you will not give tazobactams for gram-positive bacteria infection. So, gram-positive think vancomycin, gram-negative think piperacillin or tazobactam. But there are some crossover, and which is why we are perform antibiotic sensitivity tests. Keep in mind that This example of antibiotic is just a tip of the iceberg, and there are many more to choose from. That is why we have to do antibiotic sensitivity tests. The sensitivity tests tell which antibiotic works and which doesn't. I will not get into antibiotic sensitivity tests more than this because we are focusing on gram stain today. If you want to know how sensitivity tests are done, please let me know in the comments down below. Thank you for staying with me until the end. If you have any questions, please feel free to let me know in the comment down below. Lastly, if you have not done so, please like, share, subscribe, and click that notification bell. I will see you in the next episode of Blood Talks. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!